How to avoid dying in your sleep. This is a subject I've been wanting to cover for quite a while. I am Bill Vargas, Senior Health Corp, insuredmeds.com. I'm an independent Medicare broker and agent bringing you new information that you may not be aware of. Although obstructive sleep apnea and cardiovascular disease have common risk factors, epidemiologic studies show that sleep apnea increases risk for cardiovascular disease independently of individuals' demographic characteristics, example, age, sex, and race, or risk factors, for example, smoking, alcohol, obesity, diabetes, imbalance of LDL-C and HDL cholesterol, arterial fibrillation, and hypertension. Individuals with severe sleep apnea are at risk of coronary heart disease, congestive heart failure, and stroke, meaning they could die in their sleep. The underlying mechanisms explaining association between obstructive sleep apnea and cardiovascular disease are not entirely delineated. Several intermediary mechanisms might be involved, including sustained symptomatic activation, intrathoracic pressure changes, and oxidative stress. Other abnormalities such as disorder in coagulation factors, endothelial damage, platelet activation, and increased inflammatory mediators might also play a role in the pathogenesis of cardiovascular disease. Linkage between obstructive sleep apnea and cardiovascular disease is corroborated by evidence that treatment of sleep apnea with continuous positive airway pressure reduces systolic blood pressure, improves left ventricular systolic function, and diminishes platelet activation. Most important thing is to get a diagnosis. And how do you do that? By undergoing a sleep study. You go to a clinic setting or a home-based portable monitor and have your sleep registered and copied during the night. Determine what type of sleep apnea you have. There are 3 different types of sleep apnea: obstructive, central, and complex. Your doctor should be able to tell you which type you have by considering factors such as your medical history, medication, and sleep study results. Obstructive sleep apnea is the most common type of sleep apnea. Obstructive sleep apnea is when the tissue in your throat relaxes while you are asleep and block your airway. Central sleep apnea or central sleep apnea is less common. This type of sleep apnea is when your brain fails to send a signal to your body to breathe. Complex sleep apnea. This form of sleep apnea is a combination of obstructed and central sleep apnea. Pretty bad. As for treatment options, CPAP is one. Keep a sleep diary. Lose weight. Exercise every day, at least 30 minutes, either walking, biking, swimming, but get your body moving. Move your lungs. Get the blood in your body moving. And of course, the big boogaboo, quit smoking. You know, if you get lung cancer, who are you going to blame? Only yourself. Stop drinking alcohol. Drink alcohol-free beverages. Sparkling water, tea is a great substitute. Any kind of lemonade, which is also a great thing to have. Avoid certain medications, antidepressants, opiates, and benzodiazepines. Keep away from the drugs because they don't do you any good. Maintain a regular sleep schedule. Every day go to sleep the same time, wake up the same time, 7 days a week. It doesn't matter that you're not working. Wake up and go to sleep. Once you're doing it for a couple of months, it becomes a habit. I personally go to sleep at 10 o'clock every night and get up at 7. It's part of my life. Stop eating about 2 hours before you go to bed. You know, your body needs to stop working so hard to digest all the food that you take in. Wear a mouthpiece. which is your dentist can provide for you. Try taking an allergy medicine before bedtime. Clean your nose. There's saline solutions for that also. And take an allergy medicine, because the ones that make you drowsy are the perfect ones. Elevate your head of your bed, or use a foam wedge, 2 or 3 inches. Elevate yourself so your throat is in a leaning position. Lastly, the most important thing is use a CPAP machine. Constant air pressure machines are meant to keep you breathing normally through the night. CPAP machines send a puff of positive pressure into your airway at the end of each breath in order to keep your airway open throughout the breathing cycle. As a result, apneas due to the airway collapse, as occurs in OCA, are prevented. Talk to your doctor if you're having problems using your CPAP machine. Do not stop using your CPAP machine without your doctor's permission. Using your CPAP machine may improve daytime sleepiness, blood pressure, cholesterol levels, and quality of life. If you do not use the CPAP machine regularly, or use it for a while and then stop, you will lose any positive gains you made, such as improving your blood pressure. Now, let's talk about this machine. It's going to save your life. It's going to keep you from dying in your sleep. So it takes a little getting used to, but after a while, it becomes like Pavlov's dogs. You put the mask on, right away you know it's time to go to sleep. And after a couple of months, you'll be very happy that you did, because you don't want to die in your sleep. See you on the next video. My name is Bill Vargas. My company is Senior Health Corp. I'm an independent Medicare agent, meaning I work for you, not the insurance companies. I represent many companies to get you the best coverage for the lowest possible price. If you or someone you know is turning 65, please have them contact me by texting me at 845-380-5809. Thank you. Thanks for watching all the way to the end. Please like, comment, share, subscribe. And again, thanks for watching. We'll see you on the next video. Bye-bye.